We have with Dr. Snehal Parikh, who is a deputy university and is certified NDT, PNF, and aquatic therapy. She is coordinator of the IAP Women's Cell in Maharashtra and is presently working at Home Physical Therapy Solutions in New York, USA. So we welcome you, Snehal, and we will talk about group therapy in neurorehabilitation. Thank you for joining us.
Good evening, everyone from India. Thank you, Harpreet Singh sir. It is my pleasure to talk on this topic on a group therapy in neurorehabilitation. Good evening to the all participants from India and from the US. So today, definitely, I will be talk on this topic. So let's begin. If you have any questions, you can ask me at the end of this session. On the what is group therapy? Why do we conduct group therapy? Who is involved in a group therapy? How group therapy is conducted? And group therapy in neurorehabilitation. Group therapy is a helping each other and heal and grow. Group physiotherapy, it is a group sessions, classes and treatment programs are a fun, cost-effective way of having a physiotherapy treatment. The types of group therapy, there are task groups, guidance or psychoeducational group, counseling, interpersonal problem solving groups, and psychotherapy and support groups. So task groups, they are group that comes together to perform a task that has a concrete goal. Example, community, organizations, committee, planning, groups, and a task force. The guidance or a psychoeducational group, they are preventive and educational group that helps the group members learn information about a particular group topics or issues that might help to group of members that cope with the same issue. Example, transitions groups to prepare students to enter in the high school levels. Counseling and interpersonal problem solving groups. These groups help the participants to resolve the problems of living through the interpersonal support and problem solving. Psychotherapy groups. These groups are focused on personality reconstructions and remediation of deep-seated psychological problems. Support groups that deals with the special populations, like example, Parkinson's disease or spinal cord injury or multiple sclerosis or the ALS, and deal with the specific issue and offer a support, comfort, and connectedness to each other. So, example, in India, we have a multiple support group of the individual disease, like Parkinson's disease movement disorder society, India. They have a different branches, multiple sclerosis society of India, and spinal cord injury. So some are there in Mumbai, Delhi, Hyderabad. The therapeutic forces in a groups by along. It is an installation of hopes. So patients will build the hope, improve the confidence, imparting of all informations, encouragement, support, feedback, and confrontation, corrective and emotional experience with each other, and development of social skills and social interaction. There are always in particular way in therapy have advantages and disadvantages. So what are the advantages of group therapy? The group provides a social atmospheres, okay, similar to the real world. Groups provide a more opportunity for social learning. Participants can more easily learn interpersonal skills, and members can participate in a new interpersonal skills on each other. They are very cost effective. It is not require like one-to-one sessions in a cost wise. Group provide a commonality, like I am not the only one with this problem. Example, the person is not moving, like example with the spinal cord injury, with paraplegic. If he is feeling I am the only one with the group, with the other paraplegic, it's not feel like that I am the only one in the world having the same issue. The other also having the problem. So it doesn't give like demotivation. So with the exercise also, with the exercise doing with the each and every other group together, he will perform little bit confidence and motivate. Group experience help members to become aware of how others view them and what impact their behavior has on others. Group dynamics can replicate the family of origin dynamics and thus helps the group members work out old family issues. The member receive feedback, supports, and challenges that encourage or facilitate the changes. The disadvantage, it's not everyone can be in a group having the same issue or interpersonal skills. The confidentiality is more difficulty to maintain and harder to build a trust and the safety. Not enough time to deal with each person thoroughly. With the group example, with the spinal cord injury, one person is doing, so therapists cannot focus on the each and every at a single time. So there is a disadvantage also. Group leaders have a less control than the individual therapy. But definitely group therapy you can conduct at least once a week or twice a week depending on which facility you are working. So first we'll talk about a spinal cord injury is an insult to the spinal cord resulting in the change either temporary or permanent in its normal motor, sensory or autonomic functions, either the paraplegic or the quadriplegic. So different types of group therapy in SCI like supine. First you can start with the supine lying. There are few exercises like relaxation exercise, breathing exercise, upper limb strengthening in the supine, mat program with the help of caretakers, and sitting back. So if you can see this picture on the first picture, supine lying, the patients can do the passive movements with the help of the caregivers or family members or with the therapist. You can start with the lower limb movement of the hip flexion, abduction, extension, knee flexion, extension, ankle dorsiflexion, plantar flexion. You can teach to the caregivers also. That is also important aspects of rehabilitation. Upper limb strengthening with the weight scarf, with the dumbbells, depending upon the how much weights they are able to lift. Of the all the individual joint you can work like the shoulder flexion extension, abduction, adduction, elbow flexion extensions, and the wrist movements. So with this spinal cord injury, there are mainly chances of developing a spasticity. So start with the stretching program of lower leg. Like in the second picture, you can see the person is doing the knee to chest stretching, hamstring stretching, and also the ankle dorsiflexions and calf stretch. 30 seconds hold, 3 times you can do it. On wheelchair, there are warm up, cool down, upper limb strengthening, and self stretching. So on the wheelchair, the warm-up can do the active or the assisted wrist flexion, extension, and wrist rotation. You can see in this video. The counting is also important. Let them involved in a group. So let them count also. The next is this is a breathing exercise, the abdominal breathing you can do in the wheelchair, putting the hands and the abdominal. Tell them to take a breathe in through your nose and blow out through your mouth. So you can do the thoracic expansion and the other abdominal breathing exercise and the relaxation exercise. In second picture, you can see the people are laughing and watching to each other. So it's like of involvement of emotionals also, the expression of the laughing and the fun movements and the fun environment. The aerobic wheelchair exercise with the music plays an important role. So this is a continuous vigorous 45 minutes of sessions with rest in between with the short intervals to work on the cardiovascular response. So this is the most important exercise for people with the S. Moving the hands like up and forward, backward, and the sideways, pushing movements, punching movements with the hands. You can use the different kinds of equipments also. The music should be involved in a fun, effective way. Aerobic exercise with the music, with the group therapy on wheelchair. So there are the other exercise. There is a wheelchair theraband exercise, wheelchair wand exercise, wheelchair skills training, forward, backward, turning, obstacle picking up the object from the floor. So these are the few exercises with the therabands depending on the patient's resistance, like the light-weighted, medium. You can use any yellow, red, or a green. So you can use the upper limb strengthening exercise with the TheraBand. Some of the wand exercise for the upper limb like the shoulder flexion, extension, abduction, the elbow flexion with the help of the caretakers and also with the TheraBand exercise. So these are the group therapy for all the patients who work. And also the last two pictures, it is a fun activity. At the end of the session, you can give some play therapy kind of throwing the ball in the targets. So you can give the points to individual persons. So these are the exercise for the wheelchair skills training. The wheelchair forward, backward, sideways, and lift the object. In this, you can put as a time as an outcome, like the one particular patient is using 4 minutes. So next time, what the other person is maintaining. So that is a give a competitive way, like a competitions. So it will be help for them to get the improvement. So picking up the object from the floor, first you can work with the light-weighted objects from the front and from the sideways. And after that, you can give the heavy object like the dumbbells.
Yes.
So group therapy for quadriplegic, like the rolling assisted. So in this, you can take the help of, definitely with the quadriplegic require help of the caretaker, the rollings, like the use of momentum of the upper limb. At the count of 1, 2, and 3, turn to the one side with so there are different level of injury of the quadriplegic. You can give the movements like around 5 repetition or 10 repetition. Log rolling to prone on elbow with the push-ups. Not each and every individual with quadriplegic can go to the prone depending upon the level of injury and how is your rehabilitation is going on. Some patient in between take a rest. Like example, these two patients are not doing because of the level of injury was high. So my commands is also important. In between, let them also count and you let them involved in the activity also. It's not pure movement with any neuro cases, but whatever is a muscle spare they are able to do, it's fine. The strengthening in the supine and sitting balance. So you can give the with the quadriplegic dumbbells or the active movements. So they are doing shoulder abduction and adductions. This is also give important like the sitting balance and they will do the upper limb strengthening. So let's talk about Parkinson's disease. It is a typical considered as a chronic progressive neurodegenerative movement disorder. However, it is not now known as having a variety of the non-motor symptoms as well. The symptoms are tremor, rigidity, akinesia or bradykinesia, slowness of movement, postural instability, other motor symptoms, gait, dystonia, hypophonia, drooling, dysphagia, and fatigue. There are the few exercises which I did with the Parkinson Disease Movement Disorder Society with the Neurology Foundation. There are few patients with the Parkinson also. So we do the stretching, warm up, and aerobic exercises. And for the Parkinson's, we do some of the LSVT, Lee Silverman voice therapy, like the big movements, which involve all the big movements of all the joints with the voice therapy. The wand exercise, same like before, depending you can do in a sitting, standing, can work on the balance also, and plus work on the strengthening also. The facial exercise and the LSVT, like the facial, like the blowing, puffing, smiling, closing the eyes, and also the sum of the meditations and the breathing exercise also. So these are the few pictures. The balance exercises like the standing on the floor with the broad and the narrow base of support, also with the standing with the eyes open and eyes closed, standing with the single leg standing with the chair support or with the wall support, eyes open and eyes closed, tandem standing and tandem walking like the standing on a single line and walking on a single line. Some of the balance and the coordination exercise, using the clips or the small objects, move the turn and head the turn to the one side and follow the object. So you can do all the different exercise in a group together. Stroke, it is an interruption of blood supply to vital center in the brain, also called brain attack, cerebral infarction and cerebral hemorrhage and ischemic stroke. So in the stroke, usually people know there is a weakness or paralysis of face, arm and leg on the one side of body, trouble in seeing one or both the eyes, sudden confusion, trouble with the speaking, understanding of speech, sudden troubling in the walking, dizziness, loss of balance and coordination and severe headache. So some of the exercise you can also do in the aquatic group therapy with also the neurological cases. So there are some research on a group therapy which is have the articles on the spinal cord injury rehabilitation. Yeah. So I would request if the participants, if they want, they can switch on the video and do the exercise with me wherever they are in the sitting, standing, if they are comfortable. We do few small exercise like a demo purpose. Exercise, clasp your hands like this and stretch it up. If you are sitting or standing, I'm standing, and lift it up, standing on the toes. Hold for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. One more time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. We'll do few exercises like the stretching of the tricep. Hold the hand like in the opposite way and push it through the elbow. 1, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. The other way around. 1, 2,